Does sleep apnea cause lightheadedness? If you've ever woken up feeling dizzy or lightheaded and wondered if it could be related to your sleep, you're not alone. Let's explore the connection between sleep apnea and those unsettling feelings of dizziness. Sleep apnea is a condition where you have repeated pauses in breathing during sleep. This can happen for a few reasons, but the main types are obstructive sleep apnea, where your airway gets blocked, and central sleep apnea, where your brain doesn't send the right signals to your breathing muscles. One of the key ways sleep apnea can lead to dizziness is through the impact it has on your blood oxygen levels. When you stop breathing during sleep, your body doesn't get the oxygen it needs. This low oxygen level, known as hypoxemia, can affect your brain and inner ear, which are crucial for balance and equilibrium. As a result, you might wake up feeling dizzy or lightheaded. Another factor is the fluctuation in blood pressure that occurs during sleep apnea episodes. When your body's oxygen levels drop, your heart has to work harder, leading to changes in blood pressure. These fluctuations can contribute to feelings of dizziness, especially when you first wake up and get out of bed. The inner ear plays a significant role in maintaining your balance. Sleep apnea can impair blood flow to the inner ear, which can disrupt your sense of balance and lead to dizziness or vertigo, especially in the morning. Additionally, sleep apnea can disrupt your autonomic nervous system, which regulates involuntary bodily functions like heart rate and blood pressure. This disruption can result in symptoms such as dizziness and lightheadedness. Excessive daytime sleepiness, a common symptom of sleep apnea, can also contribute to feelings of dizziness. When you're not getting quality sleep, you might feel more unsteady or disoriented during the day. So to answer your question, yes, sleep apnea can indeed cause lightheadedness. The combination of low oxygen levels, blood pressure fluctuations, and the impact on your inner ear and autonomic nervous system all contribute to this symptom. If you're experiencing frequent dizziness or other symptoms of sleep apnea, it's important to consult with a healthcare professional to get the right diagnosis and treatment.